depression and having difficulty. Because if it's a trait, means if it's just a personality trait, no need for medication. Medication will not change your personality. Therapy will help you understand these traits and hopefully modify them. But if there is depression, then medications will be useful.
Okay, we have a phone, before we receive phone call, but we have now our email. If our director can show the email for health and fitness. So anybody has a question later on the show can send for us healthandfitness@media.gov.kw, fax number 244-4415. So please, I mean, if you cannot contact directly, I know some of you have a lot of problems out there, but sometimes they don't like to contact, maybe their voice somebody recognize or their name or anything. So also you can see the doctor later on. We have a phone call from Aida. Aida, go ahead.
Yes, hello.
Hello, Aida.
Good evening, doctor.
Hello, Aida.
See, I have a brother. He is 42 years old, and he has schizophrenia.
Yes, schizophrenia.
Yes, doctor, yes.
Yes.
Could you tell me, doctor, now this schizophrenia has any cure, complete, total cure for it?
Okay.
And secondly, I want to know whether this person, a person suffering from schizophrenia, can get married?
Yes, okay. These are your questions, Aida?
Yes.
Thank you
and other, he often gets these voices, he has got nearly about 4 or 5 times relapse.
Yes, yes.
Doctor, could you tell me about the...
Sure, Aida. I will talk about that.
Yes.
Okay, Aida. All right. Okay. We face this question daily in our practice. We get diagnosed with, we diagnose patients with schizophrenia. And maybe I'll spend a couple of minutes saying what is schizophrenia. Some people think schizophrenia is a split mind. Some people think schizophrenia is multiple personality. It's not split mind and it is not multiple personality. Schizophrenia is a disorder that affects the person's thoughts, beliefs, okay? And it, like I mentioned earlier, a patient can have abnormal or false beliefs, and they can, which we call delusions, and they can have abnormal perceptions. They hear voices or they see things, which we call hallucinations. They can have bizarre behavior, which means, behavior that has no meaning, no sense. They can have disorganized speech. They are not making sense when they talk. And they can have what we call they are emotionally cold. They are not affectionate. Their emotions, their ability to show their emotions is limited. If the person has 2 of these 5 symptoms for 6 months, we call that schizophrenia. Now, schizophrenia is not an easy disorder. It affects the person, and it has its serious, or it has its consequences affecting the person's life. Now, in the old days, the medications used to have a lot of side effects, and the response to these medications was also limited. And as a rule, we used to say 30% of people who develop schizophrenia can be cured. 30% will need to stay on medication, otherwise they will relapse. And other 30% or 40%, they will have minimal response to medication, which means their response to medication is very poor and they continue to have their symptoms. Probably what Ida is describing, or in her brother who has schizophrenia, maybe it is the kind of schizophrenia that is falling under the middle or second or the latter part, which means that either he needs to be on medication forever, or he is one of those categories of schizophrenia that have poor response to the medications. So to answer your questions, Ida, there is a cure to schizophrenia, and patients with schizophrenia can get married. But it depends on their level of function. If they are able, if they take their medications regularly, if they comply with their medications, if they visit the doctors regularly in the clinic, if they have a supportive environment, a family environment, and if they are stable, they have a stable personality before they were ill, or stable home. These are all favorable conditions that make what we call the outcome of the disease better. Your brother is still hearing voices, maybe again because of he is in this category of these patients who don't respond to medication very well. My advice to you, Aida, is you talk to the treating doctor of your brother and ask him these questions, because he knows your brother best and he will be able to answer these questions.
Thank you, doctor. We have a phone call from Diana. Diana, go ahead.
Hello?
Yes, Diana.
Hi, Diana.
Hi, good evening.
Hi, Lodi.
I had a question about nightmares. Are they like a sign of depression?
Nightmares?
Yes.
Okay. So is the problem, Diana, only with nightmares, or are there other...
reoccurring nightmares, and when I feel like depressed or sad, I get chest pain.
I see. I mean, are you functioning well otherwise? Are you eating well?
Fine.
Are you doing well?
When I'm depressed, I always feel full. Like I can't eat anything.
What do you mean? What do you mean depressed? Tell me, what do you mean by depressed?
Like when I feel sad from something.
Okay. So this sadness, how long does it last?
Just like a day or two.
Okay. So it's usually situational, Diana. It's...
My name's Adian.
Sorry?
Adian.
Adian. Oh, sorry. Okay, I hear Diana. Okay, Adian. It is usually what you are describing is situational. And nightmares is not a sign of depression, although people with depression can have nightmares. But having nightmares on its own does not mean you have depression. If these nightmares persist and if they happen frequently, then probably you have one of those sleep disorders, not mood disorders. Because some sleep disorders produce nightmares. So again, you will need to see a psychiatrist, because we specialize in sleep disorders, and will be able to help, recommend what's the best treatment for that, Adian.
Okay, doctor, also, since we receive all ladies tonight, all ladies, they're calling. You said it's a lot of female calls. But anything to do with the depression, with the eyesight, doctor? You lose your eyesight or something, cannot see, blurring eyes, or...
No.
Nothing to do?
Nothing to do with that, no.
Nothing to do?
No.
Okay, so let's see. Dr. Sabri, how are you?
How are you, Ahmed?
How's life?
I'm fine.
How's Dr. Zubair?
He's fine, he's okay.
When he's coming, I'm waiting for him.
I will push him for the program.
Yes, push him.
Happy Eid, Ahmed, to you and
thank
to
you.
your guest, Dr. Ahmed Gholoum.
Abdullah Gholoum.
Abdullah Gholoum, sorry. And it's lovely to see him talking about this important topic in Kuwait. And I think it's extremely important to show the whole society and the public people to know more about psychiatrist's problem. Even we are ophthalmologists or physicians or surgeons, we still see patients coming to our clinics with psychosomatic symptoms and complaints. Actually talking more or giving time more to the patients, you would know that behind all his symptoms and signs is a psychiatric or psychological problem.
Yeah.
I know in Kuwait it's a stigma to actually go and see a psychiatrist to talk about their problems. But I think Dr. Abdullah Gholoum has really a tough job here in Kuwait, trying to cut his way through educating people that it's not, you don't have to be mad or crazy to go to a psychiatrist.
Yes.
It's every single one of us that don't have a perfect personality, and I think each of us would need a psychiatrist to talk to even, or finding out our real problems. So thank you again, and thank you to Dr. Abdullah Gholoum for visiting this program. And thank you, Ahmed.
Thank you, doctor.
Okay, bye-bye.
She was my guest so many times here, ophthalmologist. That's
she highlighted two really very important points. One we discussed before we come, to the program, which is the stigma, or this bad image that people have about psychiatry, and make them reluctant to come and visit a psychiatrist because of what they see, what they hear, and what old conceptions or inaccurate conceptions or misconceptions. You know, like Dr. Sabri said, we do have a tough job, but hopefully with programs like these, which I really thank you, Ahmed, for inviting me to this program, and more effort from the professionals at the psychiatry hospital, we really need to put an effort in what we call psycho-education, or education people about mental health, about psychiatry disorder. You know, the World Health Organization only a few years ago changed the concept of health, like it's not your just body health, but it's also your mental health. So if all your organs are functioning fine, but you are, you know, if you are having fears or you are unable to sleep, that means you are not well. So it extended the health to the overall health, mental and, you know, physical health. So we need to work harder on, you know, informing people and, you know, educating. Regarding the point of psychosomatic, you know, which means that people have psychiatric illnesses, but it's, instead of saying, I am feeling low or I'm feeling anxious or I have this problem, they go to the emergency and they see the GP or the emergency doctor and they say, I have dizziness, I have some chest pain, I have abdominal pain, and they do all these examinations and everything is normal. But like Dr. Sabriya said, when you sit and listen to these people who come to visit the doctor many times, you will find that there is something else below these complaints, below these physical complaints. And most of them will be either having anxiety disorders or depressive disorders that are not diagnosed yet.
Okay, we have a phone call. Kara Feridas, I think.
Hello?
How do you pronounce your name?
Yeah, I'm Kaveri Das.
Kaveri Das. Kerala, right?
No, I'm from Karnataka, Bangalore.
Bangalore, very nice place. By the beach.
Sir, pardon me?
By the beach.
Not really, but it's Garden City of India.
Okay.
Yes. Good evening and
Hello.
related Eid for both of you.
Thank
Hello?
you.
Hello, yes.
I have a question.
Yeah, go ahead.
It's not related to me.
Okay.
Being mom and that is hesitating to speak out and keeping himself away from people and occasions is also the starting point of depression, I suppose. And this happened to one of my relatives.
Yes.
And he happened to commit suicide. And now when I see people who is just keeping aloof and, you know, when they don't mix up with people, I have a kind of confusion whether they belong to the same category or something like that.
Yes. You have a relative who committed suicide?
Yes.
Okay, and your point is at now?
No, keeping mom and hesitating things, yani to speak out, or keeping away from people and occasions. This is also kind of depression, I suppose.
Is this happening to you or to a relative?
It's not happening to me.
To a relative of yours?
Yes.
Okay.
Yeah.
Okay. So I respond to that. Severe depression, patients who have severe depression eventually commit suicide and they kill themselves. People commit suicide for many reasons, but a great number of people who commit suicide are depressed, severely depressed, not mildly or moderately, severely depressed. So most likely this is what happened to the caller's relative, that he or she had depression severe enough that they end up killing themselves. Now she is noticing that another family member is also getting isolated from people and not mixing and looking withdrawn, and she is afraid that this person might have, depression and eventually. Well, I need to say to the caller that you need really to distance yourself a little bit from, not to look over everyone who is depressed and then feel guilty that you need to take them to the psychiatrist. But if you see someone who has, clearly showing signs that they are withdrawn and they are not eating well and not sleeping well and they look depressed, then the best thing you can do to this relative of yours is to take them to a consult, to a psychiatrist for a consult, and to avoid any potential consequences.
Thank you, Doctor. Dear viewers, we'll take this break. We'll come back later, so please stay with us.